So it goes up each year by 2016, and it will still add $695 for each adult, or 2.5 of the taxable income. So now they're penalizing us for not having the insurance, when most of the time we don't have the insurance because number one, we can't afford it, and number two, our employer doesn't offer it. So this is our push to call this number or to go on the website, www.healthcare.gov, and look at the exchanges and see where you fit into this. It may be that you fit into an exchange that's going to give you a better premium than the insurance that you already have. So this is something that you have to be able to look at. Different types. You can go through real quick. So this is, you have 4 types. You have the bronze, the silver, the gold, and the platinum. Those are the 4 types of exchanges. They all have different premiums, deductibles, and co-payments. They all, you can go ahead. What they're going to do is they will all cover all of them: addiction treatment, which is usually non-covered, care for newborns, children, chronic diseases, diabetes, asthma, emergency services, lab work, maternity, mental health services, which aren't usually covered, physical therapy, prescription drugs, and preventative health and wellness. So now, once a year, you can go to the doctor, get a full physical, and it's going to be covered, whereas before it wasn't always going to be covered. All of the plans cover the same essential health benefits. The monthly health insurance premium will be higher if you choose a higher level plan. This is what the rich people are screaming about with Obamacare. They're saying, yes, you have a low premium, but you have a high out-of-pocket. So that's where you have to make the decision. All the plans are going to cover basically the same thing. So you're going to have to look at what is the culpability of me going to the emergency room or going to the doctors. How often do I go? What plan do I need? They're all going to cover your basic. So it's those add-ons that we need to look at. They're all going to cover your basic. And then each state, as they said, can add on to those plans. And that's where it's going to be figured out. So if you look here, these are examples of the types of incentives that you'll get. You can see here where the closest one, there was another page, I don't know if it's there. But if we look, you can see they're ranging from $130 up to $254. Those are the subsidies that you can get for your health plan.
So the money comes to you or it goes to the health insurance company?
What's going to happen is the government is going to give it to you as like a tax write-off, and then it's going to lower whenever you go to get your plan. So if you get the subsidy of $254, that means that when you apply to that premium package, they're going to deduct that off of the cost of it, because now they're going to be able to give it to you as a tax write-off. So you're never going to see it. It's just something like an exchange between the IRS and them, so you're not going to see it. It's almost like getting like a Metro passes or whatever, comes off your pre-tax dollars, so that's just going to happen there. If you don't have it, then that $95 is going to come off of your refund or whatever it is that you're going to get.
So the IRS is endorsing this?
The federal government, we're all the same. So they're working hand in hand as usual, unfortunately. So impact on Medicare. The law does not directly cut benefits for people on Medicare. It increases the free preventative services. Preventative, let's take care of ourselves before we need to get to the doctors. And it rebates towards the cost of prescription drugs in that Part D plan. That donut hole will be dissolved and no longer there. It's going to expand the pool of potential customers. And now the biggest thing is that insurance companies are owned by people. They're not owned by, like different entities or whatever. They're owned by people or boards or whatever. Now, 80% of their premiums that we pay to the insurance companies is going to have to be put back into the healthcare costs.
Where was it before?
In their pockets. So, and it also now says that you cannot be penalized for having a pre-existing condition, meaning penalized that you cannot not be covered. However, if you have those people in charge that are moving to shake the law, then it's going to remain intact the way it is. And so that's it. We know the government went back, and so Obamacare was on the front burner as far as that was concerned. And so now what's going to happen is they say in January we may be in the same position. So the reason that I brought Dr. Kita with me is so that we can talk about some of the things that we can do so that we don't worry about January coming. So we're not